So these are dental problems. These are dental problems. We have number one is dental caries. We're talking about tooth decay. Dental caries, also known as tooth decay. You can see dental caries there. And when you talk about tooth decay or dental caries, you are talking about sticky substance being decayed. We call the sticky substance plague. The plague is there so that when you wake up in the morning, you put your tongue through the surface of your teeth. You observe that there is a kind of film there. That is plague. So there is a type of bacteria inside that plague that decays. So that bacteria, it will combine the plague with the sugar, and then it will bring about production of an acid which will wear away the enamel, that is the top part of the outer part of the tooth, and then it will create cavity. You can see cavity here. It will create cavity. That black stuff, that's the cavity inside the enamel. And when it creates cavity in the enamel, then bacteria which could not enter before will be able to enter and cause abscess. They will call abscess. You see abscess, that is swollen part, the root, the opening part will become swollen. You can see. And then we have gingivitis, which is also known as gum swelling. You can see gingivitis here. You can see the gum becoming swollen. You can see the gum. So it is because the bacteria that act on the plague are able to infest the gum. They enter the gum and they break down some sugars in the gum, and the gum becomes swollen. You can see that. And then we move to oral cancer. Oral cancer can be caused by human papillovirus. It can also happen in some people that take tobacco products and alcoholic drinks. Understand? Okay. You can see the effect. You can see on the gum. It can be deadly. You can see on the gum. It cannot be healed. You can see, except you visit your dentist and they explain what could be done. And then we move to canker sore. Canker sore is most common to people who bite their cheeks, who mistakenly injure their lips, their gums. So that is canker sore. You can see canker sore. You can see canker sore here. Can you see canker sore? You can see canker sore. So many times you do have canker sore and you don't know the name. That's canker sore. Okay. So you can see it on your gum. You can see it on your lips. You can see it. You can see canker sore here. Then tooth erosion. Tooth erosion is that the enamel wears away. The enamel wears away through acid, not acid that are produced by plague bacteria, but we are talking about acid, for example, dietitial, or acid from your food, dietitial which present in your stomach. If it comes out, and how does it come out? Maybe you huff from it or you regurgitate, and you don't wash your mouth properly, you don't rinse your mouth, then you are liable to have erosion of the enamel. The mouth odor. You can see mouth odor. You can see that lady trying to cover her mouth because she has mouth odor. Several things can cause mouth odor. Maybe the food, any type of food you eat at a point in time. But sometimes too, unhygienic mouth can, when the mouth is not kept hygienically, they are called with mouth odor. You can see the tongue of that man. You can see the tongue filled up with white coat. Okay, and then consumption of tobacco products, poor dental hygiene, white coating on the tongue. So those are the things that can cause mouth odor. Okay, let's now go to care for teeth. How can we care for teeth? How can we care for our teeth? How can you care? Well, brush your teeth thoroughly at least twice a day with fluoride toothpaste. Ensure that the toothpaste you are going to use contains fluorine. That fluorine is very important as it makes our teeth white. Brush your tongue properly as well. Ensure that you brush your tongue properly. You can see the brushing of tongue here. You can see the brushing of tongue here. You can see the tongue is being brushed properly here. So you can see that. So, and then floss your teeth regularly. You can see that lady trying to put thread in between the teeth space. That is the places where the brush cannot get to. So you floss it, you put thread, and then you move the thread around. Eat balanced diet, healthy food. Avoid food rich in sugars and acids. Okay, eat food rich in calcium and phosphorus and vitamins. In fact, vitamin D. Drink water regularly. Choose sugarless gum. Avoid smoking tobacco. You can see the teeth of this man. You can see his mouth. You can see the teeth. What the teeth have turned to. You can see what the teeth have turned to. You can see when they are not kept. They are not kept. He smokes very well. So protect your teeth from injury. Exercise your teeth and jaws. You have to go for harder food sometimes. Not alone that you will always take soft food. Go for something you can chew. That you're like meat, like what that is most especially when people are still very young. When you are still younger, when you have children that are younger, or you are younger, you are young, ensure you take sometimes part of food that are hard. Okay, consult your dentist for regular checkups that are taken. And then if you would like to do assignment on this topic, I would like you to go to bit.ly/CRSMBautest4 bit.ly/CRSMBautest4. Thank you. All right.